When the program kicked off, it did so with a great sense of urgency. You've got the word emergency in, the name of the initiative that you lead. Is that still there? And how is that sort of sense of urgency driving you forward?
I'm glad you mentioned that because I feel like there's an incredible sense of urgency. We have the vision now collectively as a global vision between UNAIDS and the Global Fund and PEPFAR, a real alignment of what we need to do together and how we need to work with host governments and civil society in a new way, in a more really return to emergency. And I think what really woke all of us up is the UNAIDS fast track document. When that came out and said, we're headed to 2.5 million new infections per year. So you could either have that or you could have 200,000. And what would it take to get between there? Because in the reality is we can't afford the cost of 2 million new infections per year. That's per year. That's over $2 billion of additional service costs per year. There's not that kind of money. And that's why I think that there should be as much urgency today as when we discovered HAART and we had that combination in 1996. Mm-hmm. When we had that and realized that we had a therapy that would save people's lives, we should have that same sense of urgency right now.
So what is the choice that you're suggesting or asking the international community to make? I mean, we've got those two possible futures. What gets us to the preferable one?
Well, I think many people have focused on the budget, and certainly money is a part of it, but money is just a part of it. You can figure out how to do things more effectively, but that requires looking at your program data and looking at your program data all the way down to the granular site level. You have to know what's going on at your program level down to the site level to know whether you're most efficient and effective. So combining all of the epi information with the program information, with the site level information, is allowing us to triangulate information in a whole new way that people thought was not possible except through very expensive surveys. And so we're willing to invest, and certainly I think surveys are terrific, and we're continuing to do what we call HIV assessments of impact surveys. Mm-hmm. But surveys are great, but we're willing to spend $10 million, $12 million on surveys. We should be spending that same amount of money on improving the data that we have to create analytics and dashboards each year in every country so that they not only have that for HIV, but it's translatable to the entire health space.